So what are the side effects of these medications? So I've made a video that kind of pointed to that with things like headache. Some of them can cause issues with elevated potassium. Some of it can cause ankle swelling. So you have to be careful. We have to be careful in selecting the medication for the individual to make sure if they have already ankle swelling, you don't want to choose one that can cause ankle swelling. If they already have borderline high potassium, you don't want to cause it. If they have headaches, you don't want to choose XYZ. One thing I do want to stress the importance of, because people of color, black people, we are affected far worse than any other race. There's a huge disparity, and why of it? There's a lot of mistrust with using these medications. There's a lot of African Americans who have heart disease and don't even know it, have high blood pressure and don't even know it, are dying at a higher rate because there's just no trust. But there's a lot of other issues that are associated with it. We're talking about not having the appropriate resources. We're talking about not having availability of, healthy choices. So there's a lot of things that goes into that. But one thing that is for sure, one thing that has been documented, we are affected extremely high. So it's important for us to understand what these risk factors for heart disease are. Things like high blood pressure, get it treated. Also understand what the adverse effects are of these medications, but understand if your blood pressure is not treated appropriately, you will have a horrible outcome of it. It may not be now, it may not be next year, but in 20, 30 years, it likely will happen.